My name is David Howell. I am an assistant professor in the Department of Orthopedics at the University of Colorado Medical School, as well as the assistant director of clinical research in that department. I am also the lead researcher for the Sports Medicine Center at Children's Hospital Colorado. I came from a clinical background. I was an athletic trainer originally, and I found that as I was treating patients or assessing patients, there was always more questions than answers for me. What is the best way to understand this? What's actually the underlying physiology? What's a new way that we can test out and truly understand, not just in an anecdotal fashion of this worked for one of my patients, but it didn't work for another one, but on a large scale. I direct a lot of different activities, primarily related to the study of concussion. The primary area of kind of expertise, or I guess population of interest, is pediatrics, so adolescent and youth concussion. And the majority of our work right now is really focused on several areas within that. Kind of my background in training, my PhD is both in neurophysiology and biomechanics. So I usually say, kind of where brain disruption meets movement analysis or movement disruption, that's kind of really where the basic elements are of a lot of our studies. But we've really transitioned into a lot more rehab-focused studies. So we have a couple lines of research, both on using neuromuscular training and dual task training to help recover from concussions or reduce kind of persistent deficits that may arise following a concussion, as well as the use of early aerobic exercise to facilitate an optimal healing environment for particularly for sport-related concussion. A lot of the work that we do spans from kind of basic physiology, so biomarker work, neuroimaging work, all the way through kind of large-scale multi-site randomized control trials. What is the thing that you want to do? What do you want to be known for? What do you want to have an area of study around? And at the end of your time, it doesn't set you on a path toward this is the end thing that you have to be doing, but it does at least position you to kind of pursue a specific area of study. And so finding that niche is kind of, what is it that excites you? What is it the thing that gives you the most joy and satisfaction in your day-to-day kind of life? And as you look at a career out following your PhD, what are the things that you want to do? Well, it was great to have this time with you. I really appreciate the opportunity to connect and to talk about all the great things that are offered at the University of Colorado PhD program in rehab sciences. I think it's a fantastic program, and I really hope that you consider delving a little bit further into this world.